morning. I am Dr. Arun Prasad, Senior Surgeon, Minimal Access Robotic and Bariatric Surgeon at Apollo Hospital. Right now you are in the Apollo Hospital Robotic Suite, which is our robotic operation theatre, and at the moment we are doing a robotic bariatric surgery, which is basically an operation being done to reduce the weight of the patient who currently weighs around 125 kgs. And bariatric surgery by robotics is one of the newer methods of addressing the issue. It is available only in very few centers across the world, and I am very proud to say we are one of them. What happens in robotic surgery is, as you can see behind me, we've got these robotic arms which are connected to these robotic instruments that go inside the patient. A kind of instrument that goes inside the patient, and once it's inside this control, which you can see, there is an electronic interface. So that interface transfers the control from this instrument onto the robotic arm. You can see these green lights are flashing, and when I put the instrument inside, it's going to become blue. And when it becomes at that point, we are transferring the control to the robot, and from the robot to our operation console, which I'll just show you, from where I could be sitting and controlling the movements of the robotic arms. This bariatric surgery is what we call as a gastric bypass operation, whereby we connect the stomach to the small intestine and create a new passage which would cause metabolic changes in the body and produce weight loss. So now, after connecting the robotic instruments to the patient, I have come and now I'm going to be sitting in this chair, which we call as the robotic console, and from here I can actually control all the 4 instruments that happen to be inside the patient, and it gives me a 3-dimensional vision to be looking from here, whereby I actually feel that literally I am sitting inside the patient's abdomen while doing the surgery. The movements are very fine, extremely fine. It's what is known as a scaling down of movement, 20:1, and that gives us a very good control over the instruments, very precise and accurate dissection and stitching which can be possible, making the surgery extremely bloodless and accurate. So I'm going to now put my head on the console, from where I'll be able to see the inside of the patient which is connected. I shall be controlling the movements and moving here, and soon I will show you what this translates on into the patient. So this is where the instruments are being controlled by me, and these finger movements are going to get translated inside. Yeah, Dr. Alec, you can come in with the GCT.
Yeah, coming in the...
Perfect. Gas leak.
Yes sir, clean sir.
Or is it
Coming in sir.
I think it's gone this side.
Yeah.
Piche ho.
Yeah, moving out.
Aur piche.
Yes sir. Other sir.